Hi there, Mark Jabin, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. Yet another week has gone by, so it's time for the weekly update. And the story is not a good one. Across the country, the state, and for us in western North Carolina, where every county is now in the red, many well into the red. So please share this with someone you care about. Across the United States, now half the country in the red zone. You can see the change in just the past 2 weeks. And Florida, at 150 per 100,000 population, well above their last winter spike. Our neighbors continue tracking up, each with substantial increases for the third week in a row, each with almost all counties now in the red. North Carolina, you can see the case curve still steeply rising, and deaths now creeping up. There are 59 counties in the red, 39 in the orange, and now only 2 still in the yellow. In western North Carolina, all the counties now in the red zone. Some marked increases in the total number of new cases this week for the third week in a row. And you'll notice in the map Buncombe shows orange, but Buncombe County actually crossed into red this weekend. As far as testing, everyone reporting well above the 5% threshold now, a rapid rise over the past 3 weeks. For Haywood County, now well into the red zone, ended the week at 4,829 positive known cases for the pandemic. That's an increase of 143, a weekly increase last seen in early February when we were on the downside, and late November on the upswing into winter. And you can see the week over week steep rise, now higher than when we had our surge last summer. And please note in the upper graph, we are now above the line indicating exponential spread. Of the last 100 cases in Haywood County, pretty much following the age distribution we've been seeing all along. 15% under the age of 18. By the way, half of those were eligible to be vaccinated and none were. 2/3 of the cases between 18 and 65, and a quarter in those older than 65, only 4 of whom had been fully vaccinated. Overall of these 100, 17 had been vaccinated. None of those people ended up in the hospital. Now that's 17 out of 30,000 residents vaccinated in the county. Compare that with 83 cases of these 100 of the 30,000 people in this county roughly not vaccinated. So right now in Haywood County, you are about 5 times more likely to get infected if not vaccinated. And if not vaccinated, a much higher risk that your infection will end up with you in the hospital or with serious illness. Deaths, none new reported this week. Haywood Regional reached a high of 17 COVID-related admissions during the week, ending the week at 14. And both the hospital and EMS showing signs of strain, given staffing issues and many more admissions at the hospital for non-COVID related, certainly compared to last winter, all stretching the system. And the same is true for all the hospitals in western North Carolina. Well, last week I said if the doubling rate holds, we would be at last winter's numbers in the following week. And unfortunately, that's exactly what has happened. We're still on the rapid accelerating phase in this surge, with, as of yet, no sign that we are nearing a peak. And my buddy says, when you next see him upright, you'll know the sign is here. Since the beginning of July, we are at a doubling rate of just under 4 days, which is a rate at which historically we see healthcare systems being strained. And over that time, the total number of cases in Haywood County has gone from 1 to 2 to 4 to 8 to 16 to 32 to 64 to 128 to 256 and now 333, 5 weeks since the beginning of July. That's the effect of exponential spread. And if this keeps up, those numbers really take off over the next week or two. On the brighter side, though, look at this graph. It shows the experience of both the UK and Netherlands, both of which had their Delta surges before us, and each with significantly higher vaccination rates, certainly better than ours. And as you can see, they each experienced a rapid rise, followed by a brief plateau and a just as rapid decrease, all stretching out over about 2.5 months. So if our experience follows this, we should crest the top in about a month and be on the way down by October. But then we don't have as high a vaccination rate as those places. And the Delta spike in the UK and Netherlands came in the early summer. Ours is coming as school starts, and fall viral illnesses are poised to be here soon. This will certainly complicate the picture. So tuck in, everyone. The more careful we all are, the better chance we look like the UK and Netherlands, and the less likely we look like India, which was devastated by Delta. So be well and be careful, especially right now.